Hello and welcome to Let's Talk, a series of podcasts produced by the Hazel and Betty Ford Foundation on the issues that matter to us and the issues that we know matter to you too. Prevention, research, addiction, treatment, and recovery support. I'm your host, William Moyers, and today we're joined by the Chief Medical Officer of the Hazel and Betty Ford Foundation, Dr. Marvin Seppala. Marv, welcome.
Thanks, William. Glad to be back.
Always good to be with you as a fellow traveler who's been walking this walk for a long time now at Hazel and Betty Ford, and even before that, in the real world.
Yeah, it's always a treat.
Yeah. So today we want to talk to you about health risks of marijuana use, and I want to just cut right to the chase, Marv, and ask you, is marijuana a gateway drug?
So it depends on how you define gateway drug, because we called it a gateway drug for a couple of decades, and all of a sudden there was some research that said, well, you know, milk, almost everyone who ends up on opioids and cocaine drank milk at one point in their life. So it's an association, not absolute. And yet since then, people have re-examined it again, and now, you know, we call it a gateway drug because almost everyone who goes on to the more problematic substances, the opioids, heroin, cocaine, the stimulants, has used marijuana, and they get exposed to a culture of use of other drugs. And so there are risks associated with marijuana that put people at risk for using these other substances as well.
What are the health risks of marijuana?
You know, the health risks of marijuana start with concern about lungs, right? There's been a new kind of accumulation of all of the research data that came out in 2017 that was written up by the Academies of Science, Medicine, and Industry. And in that kind of review, they said that there's no evidence at this point in time of lung cancer, of COPD, or other major lung illnesses associated with marijuana use, which surprised me because I've been waiting to hear that it causes cancer for years. And it's a hard thing to study because in the past anyway, most people who smoked marijuana also smoked cigarettes, really confounding the data. But currently they say no, but it does cause chronic cough and bronchitis, things we used to know tobacco did before we knew it caused cancer. So maybe there's a risk, maybe there isn't. We don't know yet. It does increase the likelihood of psychosis and schizophrenia. Almost doubles the likelihood. Doubles. It's still very low. It's a 1% type thing to 2%, but doubling the risk of a severe mental illness, really debilitating lifelong mental illness. That's a big deal. And it's an association again. It's not known to absolutely cause it, but the more you smoke marijuana, the more frequently, the higher the amount, the higher the likelihood that you would get this type of psychosis or schizophrenia. So that is a big deal. One of the main things that marijuana affects in regard to health is our cognition, how we think, and learning, memory, and concentration are affected for a 24-hour period after the use of marijuana. It's pretty cut and dry. So we know there's an acute difficulty with how we think and what we remember for 24 hours. There's not been evidence of long-term changes that have been absolutely nailed down in the research. Now, do they occur? Maybe, maybe not. We just don't know yet. Nonetheless, if it lasts for 24 hours and you're using every day, it's kind of happening all the time, you know? And there has been some studies that suggest diminished IQ. And a recent study just published last year suggested that minor changes in IQ over time with people who smoked a lot of marijuana chronically. So there's really, the jury's kind of out, but we absolutely know that for a 24-hour period, it's a problem. And like 10, 12 years ago, there was an Australian study, airplane pilots, they put them in simulators. And they were naive to marijuana, which is an important point because, you know, you get used to things.
So you mean when you say they're naive, they hadn't used
They'd never used marijuana. Okay. Mm-hmm. And they're used to being in simulators. They had to do it regularly and pass tests and stuff. So they put them in the simulator after they smoked marijuana, and everything went well until they threw in something really unusual or novel. And then they failed every time. They brought him back 24 hours later, and the only reason I bring this up is this 24-hour period. They brought him back 24 hours later, and the same exact thing happened. They flew well, the simulators, everything fine, until they threw in some, like an engine goes out or something weird that was really dangerous, and they couldn't respond. They failed it every time. Really consistent with this new data that suggests for a 24-hour period, your ability to remember things, to learn things, to concentrate on things is truly effective.
What about teens and marijuana, though? We know that there is proof of the harmful effects of marijuana with teens, correct?
We do know that the earlier you start using any substance, marijuana included, the higher the likelihood of addiction. And as a result of that, teen brains aren't going to fully mature until their mid-20s. All this changes in brain function and how the brain's developing, affected by a really powerful medication or drug like marijuana, alters how the brain develops. And so, yes, it does change, and part of that change is to put people at risk for addiction later on. Mm-hmm. And you'd have to argue that if for 24 hours it's affecting learning, memory, and concentration, that it potentially could do that for a longer period, even though that hasn't been proven yet. But you have to wonder.
Now, I'm sitting here thinking that some of our viewers and listeners are chuckling because they're saying, oh, come on, Dr. Seppala, come on, Moyers. We smoked marijuana back in the old days. What's the difference between back in the 60s and 70s and now? But that's actually a big difference, at least when it comes to the potency of marijuana. Can you speak to that?
Truly, remarkably different. So marijuana purchased on the street when we were young, probably 5% THC, and THC is the active ingredient that causes intoxication associated with marijuana or cannabis, whatever you want to call it. Nowadays, on average, especially in the states that have legalized it, it's 25% on the marijuana, and that's actually a low number. The people that are really connoisseurs, or whatever you want to call it, they want averages way, way higher, and you can buy edibles and concentrates and waxes and all these different types of THC products where the percentage is almost 100%. It's well above 90. Mm-hmm. So dramatic difference in the potency of that substance. And in fact, to the point that I made earlier about psychosis and schizophrenia, a lot of people get paranoid from marijuana. Mm-hmm. Well, at really high doses, it's a lot more likely because it's just so powerful.
Now, I know your perspective is grounded in all of your years as the chief medical officer, as a psychiatrist who's a real leader in the field of addiction medicine. You also have a personal experience, many, many decades as a man walking that walk in recovery. So I know you're biased, obviously. You can't help it. We all are, based on our own experiences. What do you say to people in the states that have legalized marijuana? And we know at Hazel and Betty Ford that we are opposed to the legalization of marijuana, although we have refined our position, have we not?
We have. And in those states that have legalized recreational marijuana, they did nothing to protect our youth. And that's my main concern. It's more likely to cause damage in our youth. It's more likely to alter people's lives when they start young. It's more likely to result in addiction when they start young. And none of those laws put into position something that would protect our youth. Mm. The whole West Coast and British, now all of Canada, but it was just British Columbia, have legalized recreational marijuana. And none of those states did anything about this and put into place, some of the proceeds to provide treatment or intervention services or even just education for our youth because, historically, NIDA has looked at perception of risk associated with marijuana for decades. And among our youth, when perception of risk goes up, so our youth recognize that it's, problematic to smoke marijuana in some ways, they're less likely to do it. When perception of risk goes down, they're more likely to do it. And that graph is just consistent over time. And so if you legalize something, perception of risk drops, right? Sure. I mean, our youth think it must be pretty safe. And as a result, more are going to seek it out and use it. And since we didn't put in those protective sort of aspects, right, and from a regulatory standpoint, our youth will be, they're there will be consequences to our youth as a result. There will be over time more use.
What about medical marijuana, though? I mean, what about the people who say, gosh, for chronic pain or palliative care, marijuana is a really invaluable tool in managing chronic pain. Is there a role in medicine for marijuana, or is there a role in managing chronic pain for marijuana?
There's pretty good research evidence that shows that marijuana does limit pain, does reduce pain. So it really could be the case, but there's not adequate research to understand what that means at this point in time. And so is it THC, the active intoxicating ingredient to the marijuana? Is it another type of cannabinoid, CBD, that does it? Is it a combination of those things? Is it there's over 300 different chemicals in cannabis. So could it be something else we don't even know about yet? And the government schedules marijuana as a Schedule I substance, which means it has no medical utility and it's extremely dangerous, both of which aren't necessarily true, because it looks like it actually works for pain, and we know that it isn't that dangerous. It's dangerous, it has the potential for addiction, has some side effects, but it's not dangerous like the other Schedule I substances, like heroin, for example, the medicine, the LSD, the things that we cannot legally use.
Right.
So it's remarkably absurd, and it limits research. Because if it's Schedule I, as a researcher at some academic medical center, you can't just go buy some marijuana and study it. You've got to go through the government to get the appropriate licenses to be able to do this, and they've restricted it over time, which has resulted in a lot of research about risks, because that supports how the federal government has looked at this over time, and hardly any research about benefit, which means when I say there is evidence of benefit in pain, it's from a small amount of studies using marijuana itself, and not some of the chemicals in marijuana, to really try and define what works and figure that out. So it tends to work for pain. It can help with people that have cancer chemotherapy agents for nausea and vomiting, so that they have an appetite and can eat. And that's been pretty well shown. And then folks with multiple sclerosis who get really tight muscles, and can't move smoothly anymore, it actually can help reduce that. And that literature is pretty solid too. There's some other effects that it may be beneficial for.
But what about in the treatment of opioid use disorder? Is there any role for marijuana?
No, that's just a fallacy that I think, big business is behind marijuana now. It's huge dollars.
Traded on the stock exchange.
Yeah, it's described as a billion-dollar industry, right? And so the more they can convince us it's beneficial for such things, the more people will use it. And there's just not good evidence that it helps at all for opioid use disorders. In fact, the opposite is true. We know that from several studies, actually, mostly outside of the United States, but not entirely, that Australia was one of the places where some of these were done, that showed that ongoing use of marijuana actually resulted in more use of opioids, not less.
Interesting.
And didn't necessarily help with chronic pain. And that's the issue with the opioids, that they're incredibly useful for acute pain, like after a broken leg, after surgery for just a few days to a couple weeks, remarkably beneficial, and if done right, a very low likelihood of addiction, because you're only using them for a short period. Chronic use of opioids for months and years, that's where the addiction rates skyrocket.
Right.
And the data suggests that marijuana doesn't really help for chronic pain. Maybe it does, maybe it doesn't. We don't know. We haven't had enough studies to really figure it out. But hopefully, people will be able to start studying it a whole lot more now that it's getting more acceptance.
Well, marijuana is certainly a contentious topic, one that we thank you for bringing your expertise to and your insights to today. Dr. Marvin Seppala, the Chief Medical Officer of the Hazel and Betty Ford Foundation. I'm William Moyers, your host, and we thank you for joining us for another edition of Let's Talk, a series of podcasts on the issues that matter to us and we know matter to you too. Please join us again for another edition.